I'm Dr. Marc Pierson, and I've been an internist and an ER physician for about 20 years, and for the last 14 years I've worked for Peace Health, leading community-based clinical information initiatives in Whatcom County, Washington, which is about 90 miles north of Seattle. Welcome. In the age of the internet, there are some things about today's healthcare system that really just don't make sense. Think about it. If today's healthcare system was managed by if today's healthcare system managed the banking industry, you could only make deposits at one branch because that's where your records are. Your ATM card would only work with machines from your bank. Your balances would frequently be wrong because of the teller's illegible handwriting. And withdrawals would take hours because the taxi has to go get your money from the main office. Today, we're going to talk about how we can change that. In this room are dozens of partners who have made a commitment to that change, a commitment to create new applications and to help people live longer, healthier lives. This slide, I hope, shows logos from 45 partners who are here today, organizations who believe that it's time to bring healthcare into the new century. My organization is one of those. I'm up here today because I can tell you that although we do have information problems in medicine, it can be fixed, and we are doing that in Whatcom County. 5 local institutions and a lot of patients have been involved in a multi-year process called Redesigning American Medicine with the Robert Wood Johnson Foundation and the Institute for Healthcare Improvement. When we started this journey, we actually thought that our patients wanted access to our business medical records. They told us that actually they didn't. They wanted access to their own health records, records where they can enter information, records where they can share it with people they didn't necessarily think we would want them sharing it with, and they wanted to control who could see it. This was a big shift for us, one that I think is becoming a trend, the shift of health management from solely the physician's office into the patient's home. In Whatcom County today, 1,200 residents are actively using something they named the Shared Care Plan. This is a community-wide, patient-controlled personal health record that's integrated into our county's medical system. It's available to the patients and their physicians everywhere, and especially it's appreciated in the emergency department by the families and the doctors. Among other things, it includes prescriptions, allergies, and advanced directives. The benefits have been remarkable. For example, diabetics who had this shared care plan and care managers markedly improved the measures, the diabetes measures for their blood pressure, lipid, and blood sugar control when compared with actually less sick patients in the same practices. Also, the first 40 of these patients where we measured this decreased the cost of emergency room visits and hospitalizations by over $3,000 per person per year. A major reason that we were successful is that we focused on the family and the home. We learned that families are competent and that they know how to look out for each other if we're given the tools. Based on our experience, I firmly believe that any organizing principle in healthcare must at its core focus on the family and the home as the key. To scale what we've been doing in Whatcom County on a national basis requires an extensible infrastructure and a shared data platform on which everyone, patients, providers, payers, employers, the whole industry can share and exchange data. Microsoft has built that platform, and I am an enthusiastic supporter of their vision around families, partners, and privacy. To wrap up my comments, I want to reflect on the complexity of the healthcare system. To create a shared data platform will require the enthusiastic support of participants in the entire healthcare ecosystem. This situation reminds me of an African proverb: if you want to go fast, travel alone. If you want to go far, travel together. Today, Microsoft is inviting all of us to help our patients and our enterprises so we can go far together for a healthier America. Now I'm going to pass things over to Dr. Marc, who will be talking about the most important part of the healthcare ecosystem, the family. Marc.
Thank you, Marc. saying.